Hi, this is Dr. John Olkowski from EyeSight Hawaii, and I just wanted to answer a few common questions that patients often have about cataracts and cataract surgery. First question is, can you see 20/20 vision and still have a cataract? And the question is yes. In early cataracts, you can still have 20/20 vision, but you can begin to see, a little bit of change in vision, a little bit of blurry vision, and we as ophthalmologists can see that the lens is beginning to turn a little bit yellow. Sometimes with early cataracts, patients can experience significant glare at nighttime, particularly when driving. And this can be very visually disturbing, and this can be a reason to do a cataract surgery, even though the vision may seem 20/20, but the vision is incapacitating and hindering your daily lifestyle and your driving abilities. One other common question is there a way to keep cataracts from getting worse? And in actuality, no. What brings on cataracts is probably a combination of dietary changes, probably lifestyle, sun exposure, and probably a little bit of genetics and a combination of all three of those. But there's nothing really one can do to prevent getting cataracts. And everybody, if you live long enough, will get cataracts. There are multiple types of lenses that we use for cataract surgery. And again, what is a cataract? A cataract is a cloudy lens inside the eye, and we remove that lens and put an implant lens in its place. Implant lenses for cataract surgery have been around for 50 years. And traditionally, implant lenses are a single vision lens set for distance vision. New generation of lenses came out in the last 10 years, and two main classes of lenses that help patients with reading vision. First is multifocal lenses, and a multifocal lens is a single piece lens that has sort of a bullseye pattern of near, far, near, far, near, far in the lens that allows you to see near and far. Two of the disadvantages of multifocal lenses are, one, sometimes patients get nighttime glare or halos off of those lenses, and additionally you lose a little bit of visual quality in the distance vision. Another class of lens that I'm very, very fond of is something called a crystal lens, which is a focusing or accommodative lens that actually focuses in the eye and lets you see far, intermediate, near. Gives you that full focusing back. And it's a single piece lens, so the visual quality is phenomenal. And this indeed is the lens that I implanted in my mom a couple of years ago. And my mom's happily without glasses at 87 years of age. One other thing that you can expect with crystal lens is a little bit of a learning curve. So initially you do have to train the brain-eye mechanism to focus the lens again. And what you can expect as a result is usually reading normal size print with decent light. You won't get very, very teeny print, or you won't get reading by candlelight, but normal print, normal light, which is just quite a benefit of getting this lens, and patients really enjoy this outcome. The recovery time after cataract surgery is usually quite quick. Patients are a little bit scratchy that day. The surgery itself takes about a half hour. It's an outpatient procedure. And you go home, rest that day, and most people have a very speedy recovery and doing quite well the next day. Post-operatively, we do ask patients to avoid lifting heavy weights and doing a lot of bending for the first week. But other than that, most people are back to normal daily activities quite quickly. One other new development with cataract surgery that evolved over about the last 2 years is how we remove the lens from your eye. Traditionally, what's been available for the last 25 years is an ultrasound technique. An ultrasound breaks up the lens and removes the lens from your eye. 2 years ago, a laser technology came out which automates some of the procedures that we've traditionally done by hand, namely breaking up the lens into tiny little pieces even before we enter the eye so that the lens material comes out quicker, faster, easier. So it's a very exciting time in ophthalmology and cataract surgery, and I'm very privileged to be able to offer these wonderful new technologies that really make people's lives better, makes your vision better, makes what you can do easier, and makes life a lot more fun. So if you have any questions about any of these things, any of these technologies, please feel free to give me a call at the office at 735-1935, and I'd be happy to chat with any of these things with you. Thank you very much.